So if we're going to provide the best care for patients, we need to be on the cutting edge of clinical research.
When a physician asks himself or herself, what are things that I can do to make a device or a drug therapy or a procedure or a protocol better for the outcome for my cardiovascular patients, we all benefit from that.
I think it was the year 2001. He had about, I think it was his third or fourth heart attack. And my daughter was home from college. It was Christmas time. She never went back because she was too afraid. And I remember that feeling, being the daughter of a dad who had another heart attack.
I've had heart disease for close to 22 years, at least diagnosed, and had numerous events over the past 22 years, culminating recently in a heart transplant 2 weeks ago. And if nothing else, the Institute was there to say, there are things we can do. There are options. And they put their money where their mouth was.
Research forms the fundamental basis of advances in medical care. Without an organization such as MHIF, which can support us in our research endeavors, we cannot really advance medical sciences.
Hypertrophic cardiomyopathy, which happens to be the most common cause of sudden death in young people, occurring in 1 in 500 in the general United States population. We've made a number of major contributions to the care of these patients, and primarily have converted hypertrophic cardiomyopathy from a grim prognosis to a treatable disease because of this Minneapolis Heart Institute Foundation program. There are a number of young people alive today that would not be.
Given that 5 times more women die of heart disease than breast cancer, and most women think breast cancer is their greatest threat, I think our goal is creating awareness. Only 6 out of 10 women know that heart disease is the #1 killer, and only 1 out of 2 women would actually call 911 if they were having symptoms of a heart attack. And so through community programs, through awareness, by getting women to have conversations with their mothers, their daughters, their sisters, their friends, to learn about heart disease prevention, we hope to really make an impact on the community in terms of both awareness, helping women prevent heart attacks from happening, and through a lot of the cutting edge research that our cardiologists do, help improve treatments of women with heart disease.
One of Kevin's biggest contributions to the Minneapolis Heart Institute Foundation was his idea of the Heart of New Ulm project.
And the project really comprises community interventions, healthcare interventions, and really changing the environment in the city of New Ulm.
Kevin was a preventative cardiologist. That was his true area of clinical expertise, and he felt that if we could try to intervene on an entire community rather than on an individual, that might be the most effective way to combat cardiovascular disease.
I had my first heart attack when I was 26, so I worked quite extensively with Dr. Kevin Graham and his team in putting together a game plan that would hopefully remedy or rectify my cardiovascular disease at the time. I had another episode 4 years later at the age of 30, and then 21 years later had a triple bypass surgery in January of this year with a defibrillator put in late June. So the Minneapolis Heart Institute is very near and dear to my heart.
Dr. Graham is my knight in shining armor, who has pulled Rod through not 1 but 2 difficult episodes, and has walked a path with me and our sons while he was taking care of Rod. And I have seen Dr. Graham save lives, and particularly one that is very special to me.
I said, Kevin, how does it feel? I said, you saved my life. And he said, I went through school, I went through all the internship, fellowship. I've spent my life learning so I could save a friend's life. Obviously, that touched me.
After this last surgery, the transplant, is the first time in 20-some years that I've had optimism, as Dr. Henry said, about my future, and I'm very grateful for that. Very, very grateful.
We have this day and you're able to see these patients that you've taken care of for 10, 20 years, people who couldn't go to their mailbox and now can walk a mile, patients who couldn't play with their grandchildren and now can. And I think that's what's remarkable, that you have an opportunity to have people see their kids grow up.
I've never felt so positive about a group of people and their mission than the people here. It's just been crazy, and it's got to the point where these aren't my doctors and nurses, these are literally my friends.
If there's anything I can do, I think it's payback time for me after what they've given me.
It's an organization that has a really big heart.